Today, we're presenting for Homeless Not Toothless, providing free and quality dental care to the underserved and disadvantaged. My name is Alejandro Pullum, and I'd like to introduce you to the founder, Dr. Jay Grossman.
Hi, my name is Dr. Jay Grossman. After I completed a tour of duty as a dental officer in the United States Navy, I opened my private dental practice in Brentwood, literally walking distance from the VA hospital. And I'm sure many of you have seen this scene before on that street corner and many street corners throughout the United States, where it says, "I'm a veteran, will you help?" And I was really conflicted with what to do. Here I am, a former dental officer where I used to treat these patients for free, and now they are out of the military and they don't have access to dental care. And many of them are homeless because of dental care. So I decided, instead of giving them $1, not knowing where that was going to go, I decided to give them my business card. And that's how Homeless Not Toothless got started 30 years ago.
And I want you all on a personal level to imagine what it's like to see a loved one repeatedly overlooked. Perhaps you have a parent who's struggled for some time in their life, and I want you to imagine what it's like to see someone that you love working so hard, but repeatedly having doors slammed in their face. And you know that they would do so incredibly well in any friendship, any relationship, any job, but they're never given a chance for a reason as upsettingly simple as their teeth. I personally know what it's like to see a parent really struggle, and I can't emphasize enough how disheartening and heartbreaking it is to see someone worth so much being given so little. For the patients that Homeless Not Toothless serves, one simple thing is a barrier to the life that they could and should be living. And while Homeless Not Toothless can't solve all of the problems causing homelessness, they can remove one massive barrier for people who are trying to change their own lives. This testimonial gave me chills when I read it, and I'd like to give you all a chance to read it as well. So this testimonial really spoke to me because this man used so few words to explain the massive impact that Homeless Not Toothless had on his life. Homeless Not Toothless gave me teeth. What else has to be said?
Homeless Not Toothless was founded when I completed my tour of duty, which was right after the Persian Gulf War in 1991. And when I handed out my first card, we were not a nonprofit, but shortly thereafter, we noticed that the need for our unhoused veterans was so huge that we became a 501c3. And I'm thrilled to state that 30 plus years later, we've now treated over 124,000 patients. Over $10 million of free dental services have been done. It's really one of the most amazing parts of my life and my legacy is not the tens of thousands of patients I've actually treated in my private practice, but the enormous communities of unhoused veterans, women of domestic abuse, and also foster children that now get treated through Homeless Not Toothless. We have a $1.1 million budget each year. We are very, very fortunate because I am a professor at the dental college at UCLA, that I have an externship. We have our fourth year dental students actually coming to my clinic, so we actually have free labor. I donate my actual physical facility, so we actually have no rent either. And it's because of that that we have some unbelievable numbers to share. Our overhead to run Homeless Not Toothless is a whopping 7%, and that's fairly consistent over the decades that we've been running this nonprofit. The main challenges that we have is that we do not have consistent funding. We have to raise those funds. Either I personally give those funds or we go to foundations, and you know what a hassle that is every single year. We also have lab costs and supply costs. So that's what we're looking at getting money for, so we could actually treat the 12 to 15,000 patients that we see each year ongoingly with some sort of revenue stream that's guaranteed.
So our solution and our strategy to implement that solution really tried to take those things into account by taking advantage of the phenomenal care that Homeless Not Toothless is already providing while bringing in consistent and sufficient funds. And the solution may seem incredibly simple, and you might think, why didn't we do this sooner? It's to bill Medi-Cal. So, as you may know, under the Affordable Care Act and more recently under CalAIM, it has become increasingly accessible for people of low income, especially like unhoused people, to get access to this care. So essentially, by billing Medi-Cal, we would be reimbursed for the services Homeless Not Toothless is already providing to people who do qualify. Naturally, there are barriers to entry, so we narrowed down 4 steps that Homeless Not Toothless needs to take to be able to take advantage of these funds. The first one is to digitize so that we can share documents with our biller. That's already been done. Homeless Not Toothless went digital last month. Next is to enroll in Medi-Cal. It's a very difficult process. That's why we've been advised to hire a consultant. It costs $20,000 to have someone get us enrolled, start to finish. Next is to hire or partner with a biller. Ideally, we would like to partner with a biller as we are hoping to negotiate a lower rate. So we're currently in talks with Andrea Blackbird, the CFO of Venice Family Clinic. But we're also considering hiring someone else if they can give us a lower rate. Finally, we need to get primarily Medi-Cal patients because it doesn't work if our patients aren't enrolled. And we have a partnership with the Homeless Healthcare Collaborative through UCLA, and they are able to refer patients to us who are already set up with Medi-Cal. As you can see, we're very optimistic about the financials of this operation. You'll see in the first year, there is still an $80,000 shortfall, but after that, the numbers get very high very quickly. You might be wondering why and how on earth are these numbers so high? Because Medi-Cal is not traditionally seen as very lucrative. It's because our costs are very, very low. So that's why you see these abnormally high numbers.
One of the beautiful things about this program is that not only have we been around for 30 years, so we have a really solid understanding of how to run it, but we realized that we could expand this, we could scale this very easily. And what we've looked at first is looking at the top 24 cities that really have a large unhoused problem. And we're pairing those cities with already established dental schools. So if we could actually tap into those 4th-year students who are about to graduate and have them do the labor just as they have been doing for Homeless Not Toothless for decades, we really could make this a replicable, very, very low financially impactable event, because the dental schools would love to have the opportunity to have their students get expertise and experience outside of the school working on this particular population. So the management team is myself, 35 years of experience as a dentist, 30 plus years running the nonprofit, plus the CEO of Venice Family Clinic, who we're very close with, and other doctors that are already established at UCLA who have brought Medi-Cal into other dental practices in the past.
The funding that we're asking for is very simple. We're asking for $100,000. $20,000 of that will cover the consultant costs mentioned earlier, and $80,000 will cover the first year of patient care. Thank you.